Today we're going to be speaking with Dr. Kshitij Dalal, a radiologist. Thank you so much for sitting down with me today. How are you?
I'm doing fine. Thank you for giving me this opportunity to talk with you today.
Thank you for sitting down with us. So we can go ahead and get started with our first question. Please tell us about your education and work background.
So I did my medical school in India, but soon after completing medical college, I came to Chicago and did some research work at the Northwestern University Medical School. I
Mhm.
took that opportunity to get acquainted with the radiology work in this country, did some research, got some publications, and used that as an opportunity to forge my pathway to a radiology career in this country.
Mhm.
Soon after that, I did my residency, which is a required process in order to become a practicing physician. I did that in University of Florida, Jacksonville, and followed that up with a fellowship at the University of Maryland, which is also affiliated with the Shock Trauma Center, which is the busiest trauma center in the country, if
Oh,
not North
wow.
America. And soon after that, decided to grow up and take a real job and came down to Orlando and have been working at Advent Health Orlando since 2009.
Okay. So when and how did you decide that you wanted to go into medicine and then radiology specifically?
So for me, I would say the pathway, not to sound cliched, has been more predetermined or even destined. Both my father and grandfather were both the physicians and radiologists. So naturally, that was something that I grew up experiencing
Right.
and seeing all around me.
Mhm.
And it was almost predetermined that that would be a path that I would take, and it came to me pretty naturally.
Mhm.
Even during medical school, I did not opt to look at other career pathways such as surgery, orthopedic surgery, or even cardiology. I
Okay.
think I was pretty focused on doing radiology, and I think it has served me pretty well so
Okay.
far.
That's good. So far in your 12 years of working now at your practice, how has your work schedule been? Is it strict? Is it lenient?
So there has been a little bit of a paradigm shift in radiology, just like with some other fields.
Hmm.
Radiology nowadays, at least in the last few years, has moved on more to shift-based work, just like emergency room and also some OB practices. So
Hmm.
having said that, what I do is I work predetermined shifts, and it also helps to establish a level of predictability because
Right.
just like certain services, what we do is we provide ancillary but very critical services to the hospital flow.
Hmm.
And that way, we're able to help maintain the throughput of patients through the hospital and getting them well serviced in a
Hmm.
timely manner. So, for a case in point, why it is important to have shift work is because one very important thing is covering the emergency room. Every patient that enters any emergency room in the United States gets at least one sort of an imaging study, be it a chest X-ray, a
Right.
wrist X-ray, a leg X-ray, or a CAT scan of the body, and that has to be reviewed and okayed by a radiologist.
Hmm.
If there's a delay in the radiologist taking their time to get to the report, that patient ends up sitting in the ER a lot longer and thereby occupies a bed a lot longer and thereby prevents somebody else from being seen. So,
Hmm.
in order to make sure that we have enough staffing, we work shifts so that we can predict and we can make sure that all the emergency rooms and the hospital requirements are adequately covered.
Hmm. So if you suddenly need to take time off for some reason, are you able to?
Um, Usually, we are able to, since in cases of emergencies, most practices like ours, we are a pretty large group and we have partners,
Hmm.
and partners are also pretty good friends, and they are able to help you out and swap out of a
Right.
rotation if need be.
Hmm.
Uh, but for vacation, we tend to pre-select our vacations for a portion of the year,
Hmm.
and that kind of helps planning with families too.
Got it.
So we are able to take time off as and when.
Okay, that's good. What are some interesting things that you like about your job?
So one thing that I think is fairly interesting is that radiology uh, has a pretty, like we are almost like working in the background, kind of like the wizard behind the curtain, if you will,
Mm-hmm.
because we're the guys who are making a lot of the diagnoses. Pretty often a patient, let's say, goes into the emergency room with abdominal pain. The physician doesn't know what's causing the pain, so they'll get a CAT scan. And we're the sort of Sherlock Holmes, the detectives who are going through the images, trying to piece the puzzle together and coming out with the diagnosis that, hey, this person has appendicitis or this person has gallstones.
Mm-hmm.
And we kind of help finalize that treatment plan and help direct the patient towards the right course of treatment. So that I feel is pretty interesting.
Mm-hmm.
Of course, having said that, all the work it goes in the background, so frequently you don't get credit for that, but that's fine. Most of us like to be in the background.
Right. So going off of that, what do you think are the hardest parts of your job?
Um, I would say that's a really hard question to answer because after working for so long,
Mm-hmm.
uh, it feels good to be comfortable in knowing and having the experience. Um, I would say the hardest part would have been the training
Okay.
because this is not something, radiology is not something that you or a student is exposed to during training to that extent.
Mm-hmm.
Most students will get 2 weeks of exposure to radiology or maybe a month. And it is very heavily based on a subsegment of medical school training called anatomy, which is knowing the different parts of your body, the different muscles, the nerves, the tendons, the arteries. And that is something that you do in the first year of medicine and you tend to forget to a
Mm-hmm.
certain degree. But then you have to go back to it and you have to learn to appreciate that in a different way and learn to look at items or parts of your body in a two-dimensional plane and then try to piece them in a three-dimensional plane in your mind. So that
Mm-hmm.
takes a lot of training. So
Right.
honestly, radiology is not very intuitive to a student. It takes time, practice, and a lot of effort to get used to it. But I suppose that is with any field, anything that's new.
Right.
But I would say the training would be the biggest leap, the biggest jump. But
Mm-hmm.
otherwise, it's a fun pathway. It's embedded with technology. You're at the cutting edge of technology. You're working with artificial intelligence,
Mm-hmm.
and that's where the world is moving. So it's a
Yeah.
great field.
That's good. So, talking about training, do you feel like it's better for someone to go to undergrad for 4 years and then reapply to med school for 4 years? Or do you believe that a straight 7 or 8 year medical program is better?
Oh, that's a great question. And I would say, after talking to several of my friends' children who have decided to opt for both pathways, the traditional route of going to undergrad and then medical school, or even having a direct pathway approach, I would say it depends more on the individual.
Okay.
If you are sure, 100% sure of doing medicine, if you've had the exposure early on, I would definitely recommend doing the accelerated pathway
Mm-hmm.
as opposed to the traditional route. But having said that, in today's day and age, I feel that there's so many more opportunities available to students. There's
Right.
so many other ways of incorporating medicine with other aspects of technology that it may benefit the student to explore those options, take those 2 additional years, and then figure out a way.
Yeah.
It's never too late to go to school. It's never too late. So if you had to spend an extra year or two, I think if that gives you clarity of mind, there's nothing like it.
Mhm.
Because the most important thing with medicine is that it's a massive sacrifice. By
Exactly.
the time you finish your training, you're probably close to 30. That's when you actually start working.
Mhm.
And in the meanwhile, most of the other pathways, be it computer science, be it law, be it finance, or hedge fund managing, you in the business world, you're out there, you're enjoying life, you're young, you're living it. Whereas if you're in medicine, you're just busy working through medical school, doing your residency, and spending those 80 hours in the hospital.
Mhm.
So those are few things that I feel become clearer to one as one matures,
Right.
is able to taste a little bit of life and then decide what they want to do.
Mhm.
So like I said, I don't think there's a right or wrong answer. It all depends on the person's individual personality.
Right.
And of course, I think getting into the accelerated programs is a lot harder now because if I'm not mistaken, there are very few left in the country compared to what they were a decade ago.
Oh, okay.
So that could be another determining factor too.
Mm-hmm. Looking back on
Oh,
your,
also, and one more thing, I think a lot of medical schools like Cornell and Columbia, maybe Columbia, they're moving away from pre-med majors. They're looking at art majors now for the medical school applicants.
oh, wow. Okay.
So they feel that those students tend to be more compassionate
Mm-hmm.
and they have a different way of thinking. And that's what they're trying to, you know, encourage those kind of majors to apply. So there's been a massive paradigm shift now.
Oh.
So, that's something that you may be able to investigate or look into a little bit more.
Mm-hmm.
But that's something out there to consider.
Yeah, definitely. So looking back, what are some things that you wish you knew before entering radiology?
Uh, I would say, like I said in the introduction, I do have a kind of bias and skewed opinion about this field, primarily because I was exposed to it at such an early age.
Mm-hmm.
For people who aren't well versed with this field, I would definitely encourage them to spend time shadowing someone because this is not something for every personality.
Mm-hmm.
Most radiologists tend to sit in a room, review thousands of images a day. And for people who love human interaction, this may not be their fit. So that's certainly something to consider.
Mm-hmm. Yeah, that makes sense. Did you have any specific goals when you decided to pursue radiology, and have you achieved them?
Uh, I feel the most important thing was to be really comfortable with my skill set. And I feel I have achieved that with the experience and the time that I put in this field. But having said that, medicine in general is a field that is a very humbling field
Mm-hmm.
because one can never know everything. There's, and every time one feels that they've reached the epitome of their field, you will always be humbled by a case or a patient situation where you're stumped.
Mm-hmm.
And that's one good thing about it because you are constantly learning and evolving, and that kind of helps you to not stagnate. It's almost like the rolling stone gathering no moss situation.
Mm-hmm.
Um, and I kind of like that about the field a lot. There's, and also technology has improved so much over the last few years itself that I feel I'm barely able to keep up. And compared to when I was training to what we have now, the machines have advanced. We're able to see a lot more of the human body and appreciate it. We're able to make diagnoses that we could only comprehend making like 15 years ago. So I think it's technology's come a long way too. So it's really interesting. It's great.
Wow. So going through after so many years of training and now managing and working at your practice, what do you think you could have done differently on your journey?
What could I have done differently? Uh, that's a tough one. That's a really tough one. It goes back to what I said earlier. This is something that we are almost forced to keep adapting as physicians. We have to keep up with the times, keep up with technology. So you're always kind of pushing yourself to learn more, pushing yourself beyond your comfort zone.
Mm-hmm.
Because if you don't do it, you can't help your patients because your patients deserve it more than anything else.
Right.
So having said that, maybe having done an extra year of training at a center that had more advanced, equipment maybe.
Mm-hmm.
But again, that having said that, technology is evolving so fast that you become obsolete within 2 years. So you catch up anyway. So honestly, I don't know how to answer that question. I really don't.
Mm-hmm.
It's more, yeah.
So looking at advancements, we have seen the consolidation of practices and other medical facilities in the market by hospitals.
Hmm.
How do you think this impacts doctors, and how do you suggest people entering the field should deal with it?
Yeah, so that's a tricky question. Without implicating myself, I'd say. Uh, so the consolidation, the biggest thing with that is that it is beginning to take away the autonomy that physicians have been used to,
Mm,
and that is unfortunately a big negative in my opinion because medicine demands one to be nimble to be able to adapt to quick situations, and now with any big corporation, you get stymied by the rules and regulations. But having said that, I think it is only going to get more pronounced as time goes by. It is
mhm,
only going to get more challenging for the newer incoming physicians as time goes by, and that is certainly something to consider for any incoming medical student for sure.
got it.
Um, yes, there is some safety and comfort in being an employed physician, not having to worry about overheads, but that
Mm,
also means that the decision making capacity is taken away from you. You do not
okay.
have the autonomy, and that's a big deal. So I think it's only going to get worse, but we'll see where it goes.
Mm. And the last question is, considering the constant changes in the medical field, what are three pieces of advice you would give to students considering a career in medicine or radiology specifically?
Okay, so let's answer this backwards. With radiology specifically, to me, it's the best field out there. I don't think I would have chosen any other field apart from what I've done. I think it's the best field. It's amazing, offers me a perfect work life balance. I get enough time off to spend with my family, pursue my hobbies, not
Mm,
do anything if I don't feel like, as well as work and provide meaningful support to my colleagues as well as my patients. Having said that, AI is a big deal. Artificial intelligence is coming in.
mhm,
There are already several large scale corporations that are working on this, including Microsoft and Siemens. So who knows what this field has to offer 10, 15 years down the line.
mhm,
So that is one thing definitely to consider. Moving back towards medicine itself, I say that medicine is getting more and more challenging every year. There are too many um, difficulties coming up, including the one that you mentioned about the consolidation of practices.
mhm,
More importantly, what I say is that it is a massive struggle and it is a huge sacrifice. I would only recommend for someone who is really passionate about helping people to go into it.
mhm.
Definitely not for financial reasons, it's not worth it. The sacrifices that one makes are pretty significant by the time you're done following a traditional pathway. You start working by the time you're 30 or 32. In the meanwhile, all your other friends, they moved on with life.
Mhm.
That's a huge sacrifice for anybody.
Right.
And especially then when you come out and you realize the limitations that you have with the government regulations, the insurance billing, as
Mhm.
well as the employment situation, it's almost not very encouraging.
Yeah.
So I would really advise people to think twice. It is a big step. I mean, it's not permanent. You can always change your pathway if you don't want to do it, but it is a tremendous sacrifice, both financially, time wise, as well as life wise. So
Mhm.
definitely something to consider.
Yeah, definitely. Do you have any other thoughts?
No, I mean, overall, I think it's a great field. You know, I'm I'm happy. I'm able to help people, um,
Mhm.
meet nice people, and in the end, one must choose what drives one's passion. So if that is what one is passionate about, definitely go for it.
Yeah.
As long as you're happy, that's all that matters in life.
Mhm. Well, that's it. Thank you so much for sharing your guidance. I liked a lot how you talked about medical innovation and how that impacts doctors, and I'm sure your advice about all of that will help a lot of people making decisions. So thank you.
Wonderful. Thanks so much.
Mhm.
Okay.